Welcome to Science Plus Health Stories, where we uncover the silent biological mechanisms hiding within the most healthy-looking human bodies today. We often assume that if someone can run a marathon or lift heavy weights, their heart must be functioning perfectly well. However, medical reality reveals a terrifying truth. Peak physical fitness does not guarantee immunity from sudden and fatal cardiac arrest events. The video delves deep into the silent biological mechanisms of heart disease that standard fitness tests completely fail to detect early. The human body is a master of disguise, capable of masking severe arterial blockages without showing a single warning sign outside. Incredibly, your coronary arteries can be 90% blocked, yet you might feel absolutely normal until the moment the heart stops. This dangerous adaptation allows us to function daily, hiding the pathology until the disease reaches a catastrophic and irreversible breaking point. Symptoms often do not appear until it is too late, leaving patients unaware they are walking around with a silent killer. Just like a traffic tunnel that is almost blocked but still allows cars to pass, your arteries maintain flow under pressure. To understand this, we must look at the coronary arteries, the complex network of vessels that nourish the heart muscle itself. Among these vessels, the left anterior descending artery, or LAD, is the most critical component of your heart's blood supply system. Doctors call this specific artery the Widowmaker, because a blockage here shuts down the heart's primary pumping system almost instantly. If the Widowmaker is blocked at its source, the massive damage to the heart muscle often leads to immediate, sudden death. But how do these blockages form in the first place, especially in people who exercise and eat relatively healthy diets daily? Think of your arteries like a garden hose. Chronic high pressure creates microscopic tears and scratches along the delicate inner lining. To repair this damage, the body uses LDL cholesterol as a biological plaster, patching up the wounds to prevent internal bleeding. Over time, this repeated repair process causes a buildup of plaque, a condition medically known as atherosclerosis, or hardening arteries. Even athletes create this damage because intense exercise raises blood pressure temporarily, causing wear and tear on the arterial walls. This explains why fitness does not equal clean arteries. Mechanical stress, combined with cholesterol, leads to plaque accumulation in everyone. These plaques are not just inert lumps of fat. They are active, inflamed biological tissues that can grow and change silently. Now we arrive at the most dangerous phenomenon, a process cardiologists call positive remodeling, or the outward expansion of the artery. As the plaque grows larger, the artery wall stretches outward instead of narrowing inward, effectively hiding the blockage from blood flow. This positive remodeling keeps blood flowing at 100% capacity, masking the presence of a massive, growing plaque deposit. This explains how a person can run 10 kilometers feeling fantastic, while actually carrying a biological time bomb in their chest. Because the lumen remains open, blood flow remains 100% normal, hiding the deadly pathology growing within the vessel wall. Standard physical exams often miss this because there is no flow restriction to cause symptoms like chest pain or shortness of breath. However, this outward growth cannot last forever. Eventually, we face the two distinct types of heart attacks that can occur. The first and most common scenario is a type 1 heart attack, caused by the sudden rupture of a soft plaque. Soft plaques are like pimples inside your arteries. They have a thin covering that can easily tear under physical stress. When this rupture happens, the body treats it like an injury. It instantly forms a blood clot to seal the breach. Tragically, this clot grows so fast that it completely blocks the artery within minutes, cutting off all blood to the heart. This is the classic heart attack mechanism. It strikes without warning, transforming a healthy person into a patient instantly. The second scenario is a type 2 heart attack, which is fundamentally a problem of supply versus huge physical demand. This type is frequently seen in endurance athletes. It occurs when the heart muscle requires massive amounts of oxygen during exertion. If a vessel is narrowed by 50%, it might provide enough blood for resting, but not for high-intensity performance. This creates a supply and demand mismatch. The heart demands more fuel than the compromised artery can possibly manage to deliver. The result is myocardial infarction, or death of heart tissue, caused simply because the pipe was too narrow for the flow. Unlike the sudden rupture of type 1, type 2 is a failure of capacity, often triggered during the peak of exercise. Both mechanisms lead to the same tragic outcome: permanent damage to the heart muscle or immediate, fatal cardiac arrest. So, how can we detect these hidden dangers? Relying solely on standard blood work and cholesterol tests is a mistake. You can have perfect blood test results and still harbor significant plaque buildup. We need to look directly at the arteries. Advanced medicine offers two powerful tools. The first is the coronary artery calcium score, or CAC test. This non-invasive scan detects hard, calcified plaque in your arteries, giving you a score that represents your total plaque burden. A score of 0 is ideal. A high score warns you of established disease, prompting immediate lifestyle changes and medical intervention. But remember, the most dangerous plaques are often soft and invisible to the calcium scan, because they haven't calcified yet. For a complete picture, doctors use a CT angiogram. This involves injecting a contrast dye to visualize the vessel interior. A CT angiogram is the gold standard for screening. It allows doctors to see soft plaques, the unstable pimples ready to burst. This technology peels back the layers of invisibility, exposing the silent killer before it has a chance to strike. With this information, cardiologists can prescribe medications and lifestyle changes to stabilize plaque and prevent that fatal rupture event. Knowledge is your best defense. Understanding that fitness does not equal health is the first step toward true longevity. Don't wait for symptoms to appear. By the time you feel chest pain, the damage is often already critically advanced. Combine active screening with a heart-healthy diet, stress management, and proper sleep to give your arteries the best chance. While we cannot always reverse the damage completely, we can stabilize the disease and prevent the catastrophic Widowmaker event. Remember the silent mechanism. Adaptation masks the danger, remodeling hides the blockage, and screening reveals the truth before it strikes. Heart disease remains the leading killer globally, but it is also one of the most preventable conditions if caught early. Take control of your biology. Ask your doctor about advanced screening if you have risk factors, regardless of your fitness. Your heart works tirelessly for you every second. It deserves more than just exercise. It deserves deep understanding and care. We hope this deep dive into the hidden biology of heart disease helps you navigate your own journey to health. If you found this information valuable, please share it with loved ones. It might just save a life today. Thank you for watching Science Plus Health Stories. Subscribe for more deep dives into the fascinating biology of the human body. Stay curious, stay healthy, and never underestimate the silent complexity of your own anatomy. See you in the next video. This video is for educational purposes only. Always consult with a qualified healthcare professional for medical advice and personal diagnosis. Partner with your medical team to create a comprehensive plan that covers diet, exercise, and advanced diagnostic testing strategies. Community awareness is key. Let's change the conversation from just looking fit to actually being physiologically healthy inside and out. Small choices made every day accumulate over years to determine the structural integrity of your coronary arteries and heart. Managing stress is just as important as managing cholesterol. High cortisol levels can accelerate the inflammatory processes we discussed today. Science plus health stories signing off. Take care of your heart, and it will take care of you. Goodbye.